So you're starting to realize that your child is struggling in some way, maybe socially, emotionally, behaviorally, academically. You know you need to get them some help because as full of adversity as life is in the best case scenario, you certainly don't want them to struggle with something that you can actually prevent, right? But the problem is you have no idea where to start finding help for them. I'm Dr. Eric Newman. I'm a licensed clinical psychologist, and I've helped hundreds of families find the help that they need. In this video, we're going to talk about 3 big ways that you can start to find support for your child. And stay with me till the end, because on my website, I actually created a video course for just this purpose, and it dives a little deeper into all the different ways that we're going to talk about here. And toward the end of this video, I'm going to share a code with you that's not available anywhere else where you can get that video course for 50% off. So let's dive in. So the first thing I want to say is that it's never too late to find help for your child. We used to have these things called critical periods where we thought kids needed to learn certain things like language and reading, and they needed to learn them at a certain age, and if they didn't, it was kind of too late. But we now know that they're not really critical periods. We call them now sensitive periods, which means the brain is primed to learn these things at a certain age, but it's not too late if you are past that point. Nonetheless, early intervention is really important for kids, especially for neurodevelopmental disabilities, things like that, because we want to leverage these sensitive periods. And it's particularly important because there is a known pathway that goes from kind of just having this neurodevelopmental disorder or neurodivergence of some kind to becoming really anxious about the fact that you're trying to navigate an environment that's a poor fit for how you operate. Eventually developing learned helplessness, which is this idea that we've just figured out that there's really nothing we can do to make the situation any better and it's never going to be good for us, which eventually leads to depression. So this pathway from some form of neurodivergence to anxiety to depression is one that we can prevent if we get help early on. Okay, so what are the 3 ways that we're going to talk about here where you can find help for your child, or start to anyway? So number 1, if you know already that your child is struggling in school, that's a great place to start. The school system is a great place to start because A, they spend a lot of their time there already, and there's a lot of opportunity to help there. And B, if you can get help there, it's free. It doesn't cost you anything to do that. So how do you find that support? You're probably going to start with your child's teacher or principal or maybe a school psychologist or counselor, somebody in that setting where you're going to request support. And there's 3 main types of supports. There's lots of supports, but the 3 I'm going to talk about here are MTSS, an IEP, and a 504. So MTSS is sort of this first level. It's a multi-tiered system of supports where it's not special education. It's kind of delivered in a general setting, but it's to provide a little extra help to target the needs of children who may be struggling in some way. And then we've got the IEP, which is the entryway into special education. The IEP, or Individualized Education Program, grants a whole host of services and accommodations based on your child's individual needs. So you'll need to request an evaluation for that to see if your child meets those criteria. And then if they do, they're going to identify specific goals and objectives. They're going to offer whatever services are needed to meet those goals and objectives, accommodations to help your child function better in the classroom, and a whole host of other things in the IEP. There are specific criteria, though, that need to be met for an IEP, and a lot of kids just don't meet those criteria, even if they are struggling. And so the third way that you can find support in the school system is through a 504 accommodation plan. And this is a different kind of plan that does not provide the extra services, but it does provide accommodations only for your child if they have a diagnosis or disability, identifiable disability. And then you can get the help you need that way. So if you're getting value from this video, I'd love it if you'd like and subscribe, hit that notification bell so you can be alerted to more content like this. So the second way to find support for your child that we're going to talk about in this video is clinical intervention. So let's say you realize your child needs help in some way, but what you see is more at home, in social situations, not necessarily at school, or maybe you see both, but you need help at home and in social situations. You're going to want clinical intervention of some kind. And that could be anything from therapy. That could be a psychologist, a counselor, a social worker, depending on where you live, maybe a marriage and family therapist, or any other number of therapists. Then you might also consider medication. And if that's the case, you're going to be looking for a psychiatrist or a psychiatric nurse practitioner or a physician's assistant who specializes in medication. Now, these two options, a therapist and some kind of medication prescriber, you can often find these through your insurance, but it's really hard to find somebody who does both therapy and prescribed medication who actually has availability and takes your insurance. So there are other options for finding one of these people. And here's your pro tip is there are websites like the big one that people use is psychologytoday.com. And that website, you can go on there and you can search for therapists in your area. And then once you do, you can narrow it down. You can do this with psychiatrists as well. You can narrow it down by what age your child is, what kind of issues they struggle with, what insurance you have. There's all kinds of filters in there that you can use to kind of narrow it down. And you might be able to find some people that way that you weren't able to identify through insurance, especially if you're having trouble finding somebody to meet your needs. Other types of interventions in the sort of clinical, but what's more called like ancillary support services would be things like speech and language therapy or occupational therapy to address, speech language would be the ability to speak or understand clearly. Occupational therapy would have to do with sensory issues and motor difficulties. So those are kinds of supports that you might be looking for, as well as if your child has autism, they might need ABA therapy or applied behavior analysis. So these are all kinds of supports you can get in terms of clinical intervention. So the third way to pursue support that we're going to talk about here is really more geared toward what if you don't know what's going on and you need more guidance. And then you're going to be looking for an evaluation of some kind. Now, the first one I'm going to talk about here, and probably the big one I'm going to talk about, is psychological testing. This is my area of expertise, and this is a process by which we collect lots of standardized data, and we do that so we can understand not only how your child functions, the things that he or she can do, the things he or she can't do very well, but also how that compares to other children their age, so we know if it's outside the norm. And testing can be done in schools, and in that setting, they'll be doing an evaluation focused on specific areas that your child is struggling with in school. But if you need more guidance, that's not diagnostic, and you may not be looking for a diagnosis, and that's fine, but it's not diagnostic. So if you are looking for a diagnosis or you're looking for a more comprehensive type of evaluation, you're probably going to want to go to a psychologist or a neuropsychologist in private practice or not in the school system, and try to get more help that way, because then you'll be able to figure out, what's going on here. And one of the things that I do when I do these evaluations is, and most psychologists who do these do, is write a report that at the end contains a lot of recommendations. And that's recommendations for clinically, where to pursue help, educationally, how to pursue help and what sorts of help you should be looking for, as well as a host of strategies that might be helpful to you. But when it comes to recommendations, there are certain things that I say over and over and over. And actually, the things we're talking about in this video are some of those things. So for that reason, I created this course because I really want people to know what their options are educationally, what their options are clinically. And so I created this course to dive deeper into kind of understanding and knowing what to expect in those areas. And this, I told you, I was going to offer you a code. So what I want you to do is go to newmanpsych.com or just scan this QR code. And I want you to enter the code NPYT50. That's NPYT50. And that's going to give you 50% off that video course. That course is just 8 brief videos. It totals a little more than an hour. It's normally $99, so that'll give it to you half price. All right, so just to wrap this up, whether you're in school settings or in clinical setting, you can also pursue other types of evaluations, like you can get a speech language evaluation to look at language functioning. You can get an occupational therapy evaluation to look at sensory issues and motor issues. And that'll really help to focus intervention as well, whether it's in school or clinically. But that evaluation piece in general is going to be helpful when you don't have a clear sense of what's going on. So even though you might be able to figure out what to do if you did, this will give you that guidance. All right, so I hope this has been helpful. If it has, feel free to check out that course if you want more. Otherwise, stay tuned to this channel, and we look forward to seeing you soon. Take care.